Social protection features in numerous country policies and development agency strategies, as well as in several sustainable development goals. However, following more than 2 decades of considerable expansion in policies, programs, and research, the sector finds itself at a crossroads. In this podcast, we look at the research findings from the recent IDS Bulletin, Reimagining Social Protection. Leading the podcast is Rachel Sabates-Wheeler, IDS Research Fellow and Social Protection Expert who interviews Charis Reid, Social Protection Officer at the International Labour Organization, Jeremy Seekins, Professor of Political Studies and Sociology and Acting Director of both the Institute for Democracy, Citizenship and Public Policy in Africa and the Centre for Social Science Research at the University of Cape Town, and Maria Kuss, Principal Investigator at the United Nations Children's Fund, UNICEF. Drawing on key insights and lessons, the guests reflect on the role social protection plays in the shifting, uncertain, and volatile global context, including the political aspects of social protection in Africa, social protection in crisis settings, and gender and social protection.
So welcome everyone to this Between the Lines podcast discussion, and today we're going to be discussing what does the future look like for social protection. My name is Rachel Sabates-Wheeler and I'm a research fellow at the Institute of Development Studies in Brighton, and I'm currently directing a large program called BASIC, Better Assistance in Crises, that's funded by the Foreign, Commonwealth and Development Office, UK. And I've been working on and researching social protection for probably 25 years now. So hopefully this is going to be a really interesting discussion. I'm really pleased to be joined by 3 guests. Jeremy Seekins from the University of Cape Town, who's currently in Botswana. So hi, Jeremy. Do you want to say hi and introduce yourself?
Hi, Rachel. I'm Jeremy Seekins. I'm a professor at the University of Cape Town. And like Rachel, I've been working on social protection for a long time.
Great. Thank you, Jeremy. Charis Reid is from the International Labour Organization. Welcome, Charis.
Hi, Rachel. Yeah, thanks for having me on the podcast. So I'm working with the ILO as a social protection officer based in Jerusalem at the moment. I actually completed my master's from IDS almost a decade ago now, and then have been working in social protection since then, previously in Bangladesh before my current posting in Palestine. Thanks.
Great. Welcome, Charis. And Maria Kuss, an academic, researcher in social protection and gender consultant. You're welcome, Maria.
Hi, thanks for having me today. I'm an interdisciplinary researcher with a background in social protection policy processes and gender, and I'm currently working as a consultant for different international organizations such as UNICEF Innocenti and Ladysmiths, and of course I'm also a proud IDS alumna.
So, social protection. In recent years, social protection has become a huge focus in many global and national development agendas. In fact, coverage of social protection has recently passed 50% for the first time. And another sign of the traction of social protection is the number of countries that have adopted national strategies or policies. In 2010, only 5 African countries had social protection policies. And by 2019, that number had grown to 35. And for sure, there's probably even more now. So it's a big development agenda. So just to help our listeners, I thought the first question should be, why is social protection such an important issue in development? And what exactly is the problem that it is trying to solve? So Maria, let's come to you first for that.
And in a nutshell, we can think of social protection as a number of different types of benefits that are typically provided by the state and given to different groups of vulnerable people for different reasons. So think of the entire spectrum of benefits: health insurance, maternity leave, unemployment benefits, social pensions, or even scholarships that enable students like me in the past to study. So all of these programs try to solve different problems and address different types of vulnerabilities. And of course, they are underpinned by different values of social justice. However, in low-income countries, in developing countries, social protection has been promoted heavily by international organizations since the mid-90s. So after structural adjustments to provide at least some level of assistance to the many poor people who lost their jobs and struggled to provide food to the families. And so for a long time, the focus has really been on providing cash transfers to reduce poverty. Now we are at a point of rethink, and there's increasing advocacy to actually return to a broader vision of social protection that the talk about social protection system strengthening. So we are not just looking into social assistance and cash transfers, but will focus on the entire spectrum of benefits in order to be able to address the multiple needs of people to help them have a better life.
Mm-hmm. Great, thank you. Charis, did you want to add anything to that?
Yeah, actually, I mean, thanks, Maria. I think you defined it very well. Just to say that I think going back to basics, kind of the idea that everyone can become vulnerable. Whoever you are in society could fall upon a time when you are not able to produce your own income for some reason, or you need support in order to reach that point again. And so the idea of social protection, say in like developed or high income countries, then we have this understanding already that there is some kind of safety net provided by the state, or a floor provided by the state. So we will be supported for basic income. And then the idea is to deliver that kind of thing in low income or developing countries as well. That again, there should be this kind of safety net so that everyone can achieve a minimum standard of living, which often for social protection is defined through a minimum level of income. And I think also just to add that it kind of can be seen almost like a public good. And I think that's maybe been missed in development previously in the kind of narrative of just looking at poverty targeted programs. Whereas if everyone has a minimum level of income and also healthcare, then there's kind of wider benefits for societies as well. So yeah, thanks.
Yeah, that's right. It's clearly got a lot of benefits to providing social protection, particularly for the most vulnerable and poor. So, you know, we celebrate, don't we, the spread of social protection programs across the globe, and particularly the global south over the last 2 decades. But almost half the world's population, some 3.8 billion people, still do not have access. So I'm wondering, Jeremy, if we could bring you in here, what would you say to the view that social protection currently is a job only partially done?
Well, I think that has to be right, but you know the data we have on coverage shows that there are still huge gaps, and this is not really surprising. I mean, if we could think about the differences between the countries of the global south and the countries of the global north, across much of the global south, only a very, very small proportion of the population is in formal employment, right? Whereas in the global north, the countries where the welfare state was developed, you know, large numbers of people were employed in industry and in other occupations, in formal employment. And that meant that in the global north, the welfare states of Europe and elsewhere, many people were covered through contributory social insurance schemes, many run by the governments, not all. Right? But in the global south, contributory schemes, social insurance schemes, can really only cover a tiny proportion of the population. The vast majority of the population is not in a position to contribute to social insurance or even private insurance schemes. So in the global south, much more emphasis has been placed on social assistance or cash transfers financed out of tax revenues rather than out of contributions attached to employment. Now, unsurprisingly, it's proved much harder to expand coverage of social assistance in the global south because the numbers of people who need coverage are very high. That said, I do think we have to problematize this concept of coverage. The ILO and particularly does a very good job. The World Bank also, through its Aspire database, does a job in trying to measure coverage. But there's a lot of problems with these measurements. I mean, many schemes omit people because, for example, they're means tested. Right? So how do we think about means tested schemes? Well, we know that means tested schemes have lots of exclusion errors. In other words, there's people who are eligible for those protection but aren't getting covered, right? And that's a huge problem, right? But means tested schemes also, of course, exclude people who are not eligible because they, for example, have employment. Or that for some other reason, right? And is that a coverage problem if non-poor people are not covered by the scheme, right? Many people across the global south will say, no, that's not a problem. The resources should be concentrated amongst the poor. If you're poor, you should be covered. So we should be aiming for 100% coverage of poor people, not 100% coverage of all people. Right. Now, the problem is we don't really have very good data on what are the exclusion rates of poor people across the global south. We know that there is a huge category of poor people who are excluded, and that is people, working age adults who have on low income or no income, such as here in Botswana or in South Africa, unemployed people. We know that there's a huge problem that poor people like that are excluded, right? But we don't know really how big a problem it is across the whole of the global south.
Great. Yeah, I agree. And even though coverage stats might be getting better, there's even an issue of, the sad reality is that the benefits paid by social protection are almost always inadequate to cover most of the basic needs as well. So there is that. So just following up on that, Jeremy, and then maybe Maria, what do you think needs to be prioritized to ensure that we don't lose momentum on social protection? Well, what you're talking about, Jeremy, getting the right people, poor people, covered, but also the adequacy of the social protection. What should we prioritize so we don't lose momentum? Jeremy, do you want to say something first?
Yeah. So the work that I do in Southern Africa, other parts of Africa, and the work of other people, including Maria's previous work in Zambia, has really, I think, shown us that political elites across Southern Africa, and to some extent even populations as a whole, have very positive ideas about some forms of social protection and very negative views on others. Right? So the idea that there is elite support for social protection isn't true. The idea that there is elite opposition to social protection isn't entirely, that's a bit simplistic. It's not quite right. So in my research, and I think other people's research, we find that by and large there's very strong support for social protection to certain categories of people who are considered deserving. For example, the elderly, people who are unable to work. And in those cases, I think that there is quite strong support for generous support. That many of the old age pension schemes and other social assistance programs across East and Southern Africa are pretty parsimonious. South Africa is an exception, but outside South Africa, they're pretty parsimonious. And I think there's evidence that there's quite widespread support that deserving sections of the population should be treated more generously. And there's also quite widespread support that if a means test is imposed, it should be it should have a very high threshold. And it should really only exclude the very rich. It shouldn't exclude almost poor people. You then have problems of if you do that, of jealousy and so on. So I think there's quite strong support for an expansion of social protection for some groups. Right? Where there's great opposition is expanding social protection for working age adults. Right? But again, this is an area in which I think there is real potential for reform if the international agencies actually really listen to what local political elites believe. Mm-hmm. So there's quite strong support in Southern Africa, for example, for workfare programs. Now, in Europe, we think of workfare programs as being quite regressive. But in African context, workfare programs can be very progressive. And there's strong support for workfare programs. Now, I think that international agencies need to be a bit more open-minded about how they view social protection. They need to be, they need to think through their skepticism about conditionality, and they need to be more open to the imposition of conditions on working age adults, such as workfare requirements. I think if they can do that, there's a much bigger area of overlap between international organizations on the one side, national governments on the other.
Great, thank you. Thanks, Jeremy. Maria, did you want to say what you felt might need to be prioritized so that we don't lose momentum on social protection?
Yes, I do agree with a lot of points Jeremy made, particularly with regards to the focus on the perceptions of deservingness and the interaction between international actors and national elites. And this is a point that really came out of my research on aid-dependent countries in Africa, so including my research in Zambia as well as Ethiopia. So what really comes out and what international actors actually need to put attention to and focus on is to ensure that social protection initiatives are sustained in the long run, so not just initiated and then expanded, but sustained in the long run as originally intended. There needs to be a much more investments and a much more efforts into engaging public actors, including elected politicians, but also civil society organizations or women's organizations. So, for example, in the case of the policy design in Zambia, international actors, they restricted the policy space to very exclusive policy arena consisting of consultants, ministry officials, and international actors. And by doing this, they restricted or excluded potential opponents to come in and ask questions. And that actually was very short-sighted, because it was after the initiation where public opposition came up and put a lot of political pressure on the ministry, and they had to go back to the drawing board. So this could have been potentially prevented if they had involved public actors from the start, from the initial advocacy and in the design stages. And this is also a point, it's a matter of democratic principles, and critical scholars like Jimmy Adesina have highlighted this in the past over and over again. The participation of public actors must be a focus and must be brought into the fold by international actors trying to influence the policy, social protection programs and policies.
Yeah, good. In sustainability, important, and bringing in public actors. Now, on that, I'm just going to shift focus a little bit, because our listeners will be very aware that we're facing a lot of crises in the world at the moment. Uncertainties, climate shocks, conflict, economic crises, health, COVID. According to the Global Peace Index in 2023, there was the highest number of countries engaged in conflict since the Second World War. And the World Bank estimates that by 2030, nearly 60% of the world's population that is poor will live in fragile and conflict-affected settings. So that really does raise issues around sustainability for us, particularly of social protection systems and provision. So, Charis, I wonder what you think. Do you think these crises, these particularly, conflict, displacement, do they change the way we need to think about designing and delivering social protection?
Yeah, thanks. It's an interesting question. And I think actually my answer builds upon the points that Maria and Jeremy were making already, in that I think the theory that we have of social protection as being this kind of wide holistic systems approach, that would be wide enough to adapt or expand to cover these different contexts or these different groups. It's just that the implementation that we've seen in countries so far, particularly if programs are more narrowly targeted, is then not able to adapt in the same way. So just briefly to talk about international standards, which I hate doing because it sounds like a kind of big normative legal thing, but the ILO is a custodian, but kind of there are these globally agreed standards by all international actors. They were kind of ratified or agreed by all of the member states of the ILO. So that's basically most countries worldwide, and also their tripartite partners. And these stemming actually from back in 1952, so this is quite a long time ago that we're talking about, these provide like a minimum framework within which we can aim to deliver social protection systems. They would include a holistic approach. So like Maria said at the beginning, with ranging from unemployment to maternity to old age coverage. And again, kind of, I think like others were saying, they would cover a fully holistic approach in terms of social assistance, and then contributory social protection as well, and even kind of active labour market programs. So I think that theory would then be possible to, if you had that system, you would be able to adjust that system in a way to cope with shocks, whether that is an immediate acute humanitarian crisis in the first 6 months, or whether that's like a long-term conflict or displacement. Again, I always find it easier to consider what it would be like for my home country, which is the UK, compared to the countries that I've been working in. So I think that the theory is there, but when you have very kind of a focus on just cash assistance or a focus on poverty targeted programs, then you end up with systems that are not robust enough to react. And so we end up with this whole kind of narrative on making shock responsive social protection as a kind of new-ish agenda in the sector, when in reality we kind of have the design that we should be aiming towards. I just want to say one other kind of tangent as well, which is around the question of conflict. And obviously in the region I'm working in at the moment, in the Arab states, we have a lot of acute humanitarian need, but these are also protracted crises that have been going on for many years, as old as my ILO constitution, my ILO convention that I was mentioning a minute ago for the war in Palestine. So in terms of the humanitarian funding requirement in 2024, then over 90% is going to protracted crises. And that really faces a question, like poses a question for all actors, so social protection, but also all kind of humanitarian development actors, in terms of ultimately we need to transition to long-term national systems in order to have any kind of sustainable protection for populations. So it's not possible to just say that, you know, because of the conflict, then we can't develop this social protection system, or because of refugees and displacement and not being in their home country, then we can't possibly cover them, because this is a situation that will keep expanding unless we approach this differently. So we've been considering it a bit in the region, but I think it's a question for everyone needs to consider. Thanks.
Thank you. Yeah, very complicated, particularly the region that you're working in at the moment. Jeremy, this is a kind of a big question, a bit, in fact, anyone can answer it, a bit about your view. In the face of multiplying crises, what do you think social protection, you know, what's going to happen? Do you think it's going to have to expand its remit, or given that global finances looks like it's going to tighten up, particularly social protection, do you think we're going to see a stagnation in support, political and financial support for social protection?
Yeah, thank you. I think if we look at the history of welfare states and social protection, we can see that many of the spurs, many of the events that have led to the expansion of social protection have been shocks, including the shocks of war. After the Second World War, there was a First World War and the Second World War in Europe. Big expansions of social protection, really good work by Herbert Urbanger and Carina Schmidt in Germany on this. So shocks have been a big spur to the expansion of social protection. And when we think about shock responsive social protection, this is very much, in a sense, the way that welfare states have developed historically. Welfare states have never been very good at dealing with permanent crises, right? This became very clear in the history of European welfare states in the late 1920s and the 1930s with the Great Depression, welfare states couldn't really cope with the Great Depression. It was just too big a crisis for many of them. What we're seeing today is, across much of the world, is this, we're in this sort of grey area between shocks, which welfare states or social protection systems can respond to, and permanent crises, which are just, in a sense, overwhelming. So across the global south, particularly in Africa, where I mostly work, we can see there have been very positive responses to shocks. They're very positive, primarily, most importantly, to drought. Drought is historically the biggest risk facing poor people across Africa and across much of South Asia and elsewhere as well. And actually, over the last 50 years, through efforts of the World Food Programme and others, we have really good drought shock responsive interventions. We often call them humanitarian interventions, but they serve those kind of social protection functions. Right? We also saw quite a lot of very creative responses to COVID in 2020, 2021. So these are the kinds of shocks that I think are pushing social protection forward, right? But many of the big crises we face are ones that are really daunting. So, for example, across much of Africa, we can see that the proportion of the population who is able to subsist through smallholder agriculture is declining. We see growing landlessness. We see unemployment, low incomes in rural areas. We see urbanization. We see people, huge numbers of people in rapidly growing cities surviving on the margins, really precariously through informal employment. And our social protection systems are just completely, really unable to cope with this. And this is a huge challenge. I think we really need to rethink some of our approaches. As I said earlier, there are some low-hanging fruit. There are low-hanging fruit, for example, to say that there are people who are clearly losers, the elderly, for example, right? Children, right? And there's very strong support for interventions for them. So that, in a sense, the crisis of economic and social change, demographic change, we can cope with some aspects. But the huge crisis of precariousness amongst working age populations, that is the real challenge, and we really don't yet know how to deal with it.
Thanks, Jeremy. That's really interesting. Thinking about that difference between shocks and permanent crises, and how does social protection, do our systems deal or expand to one better than the other? So yeah, that's really important. So last September, myself and some colleagues at IDS, Stephen Deborah, Jeremy Lind and Katie Rowland, we hosted an international conference on reimagining social protection in a time of global uncertainty. And the three of you know about this because you participated in it and you presented pieces of work. And in fact, just yesterday, we've published an IDS Bulletin with many of the contributions to that conference, and the three of you made contributions. Thank you. And I'm encouraging listeners to go to the IDS website and get an online copy for free. So the Bulletin is organized into three themes: politics, crises, and inclusion and innovation. And each of you have a paper in those different sections. So I'm just going to ask each of you separately a little bit about your research. So for Jeremy, you've been investigating the political aspects of social protection in Africa and elsewhere for many years. We've heard a bit about it already. And so I just wonder, how do you think that international actors can best support governments and local civil society to take ownership of sort of locally appropriate, nationally appropriate social protection systems?
As I was saying earlier, Rachel, I think that international agencies need to be a lot more open-minded about which aspects of social protection they should be pushing on, and which they might want to take their feet off the pedal. I think there has to be much more consultation between international agencies and local elites. I think, unfortunately, in many cases that I've looked at, and I think when Maria's looked at Zambia and Ethiopia and other places as well, in many places, international organizations come in with their idea about what what's the way forward? They've got the expertise, they've got the ideas, they've got that model. The World Bank's got one model, ILO has its kind of model, its approach, differed as it used to be. The British, Germans, they've all got their UNICEF, they've all got their different preferences. And they tend to sort of push their preferences and the normative assumptions underlying those without really much regard for what local elites are thinking. Now, Maria's got a brilliant paper where she interviewed MPs in Zambia. And MPs, she shows that in Zambia, that MPs were very good at listening to what the agencies say and then repeating that discourse, but they don't really change their basic views and attitudes around issues, right? And I think it's really because the international agencies come in and don't do enough listening. I think international agencies need to come in and say, okay, what do you think are the priorities here, right? There's funding available under certain sort of conditions or within constraints. What do you think should be the priorities in addressing the challenges of vulnerable groups in your countries? And there should be much more of a dialogue around that. Now, of course, international agencies should, of course, be promoting their own particular views. They should be encouraging civil society organizations that think like them. That's fine, but they shouldn't be simply imposing their vision of the future on national governments and local political elites. I think more open-mindedness can be very productive because I think, as I said earlier, there are low-hanging fruit on which there is widespread agreement amongst national governments and political elites. There's widespread agreement that there are areas of social protection that can and should be greatly expanded. And those are the things which I think if you have a dialogue, you'll focus on and then prioritize.
Thank you. And just final question, Jeremy, to you is, in light of your own research and findings from your own research in recent years, what would you say one or two key challenges are for social protection? Maybe you've already mentioned them already, but if not, were there one or two challenges that you think social protection really does face as a development agenda going forward?
Well, I think, Rachel, that, I mean, as I said, there's some easy answers. For example, expanding old age pensions. We know how it can be done. We know how it's possible to craft, to build very widespread support for these programs. So there are very successful models we can emulate, right? In general, I think we're rather better at intervening in rural areas than we are in urban areas. And it's partly because we have across Africa, certainly, a long history of intervention in response to droughts, a long history of intervention to support smallholder agriculture, right? So we have, in a sense, better systems. We are very unprepared for this rapid urbanization we can see across much of Africa, right? In Europe, welfare states were really built primarily around the needs of urban and industrial workers. In Africa, welfare states have been built primarily around the needs of rural populations. Adjusting to this challenge of urbanization is absolutely a huge challenge, and I don't think we've got to first base on it yet.
Yeah, I agree. I agree with that. Thank you. It's a huge challenge. Charis, you've contributed a paper into the Bulletin and to do with crises, and you work, as you've said, on social protection with the ILO, focusing on Palestine, and you've been working to strengthen the national Ramallah-based social protection system, as well as leading and facilitating coordination efforts between humanitarian development actors. The ILO's regional social protection team in the Arab states have been reflecting on their work in the context of protracted crises. So given that this is kind of the space that you live and breathe and work on at the moment, I wondered if you can tell us what you might have learned about how to strengthen humanitarian development transitions, using international labour standards or using, the tools that you have available within the ILO.
Yeah, thanks. I think it's difficult to chalk about these things during the current war, which seems to keep escalating. But we had carried out this research. Actually, I guess the conference last year was in September, so then just before the war started in October. And then we have been kind of building on or learning more and trying to implement more of our findings since then as well in these countries in the region. Just to briefly mention the kind of background to the paper, and it links actually to what Jeremy was just saying, because we have these kind of normative frameworks that I think at a global level, someone sitting in Geneva can say, yes, this is how social protection should be done. But we have been trying to understand how that works in reality in protracted crisis contexts in the region, and particularly in the standards that I was mentioning before. The primary responsibility of the state is key. That's like the central hook that everything else falls off. And how can these standards remain relevant or be relevant in cases where the responsibility of the state is not absolute for specific groups of population, or they don't have complete authority over the area? And I think we've seen kind of similarities in different countries in the region. So things like long-term safety nets that are delivered by non-state or humanitarian actors, which were designed as short-term interventions, but have somehow perpetuated into the long term. And also that the lines between what is humanitarian or development in terms of financing or programs or actors, the lines have been completely kind of blurred between these different definitions. So in that context, and based on our work in these different countries, I would just highlight kind of 3 lessons or 3 learnings. One is the need for holistic systems thinking, which is what we were mentioning at the start. So looking beyond just cash assistance to also social insurance, labour market programs, particularly it's an issue in the region in terms of unemployment. There needs to be coherence between these different schemes, but also crucially, if you can stimulate employment and then link people into social insurance, they can still be protected by a social protection system, but it can be much more sustainably financed in the long run. So that's the first thing around holistic systems thinking. The second is that and this is actually a learning since the war as well, in the immediate onset of a crisis, that social protection should still be kind of considered where possible. So ultimately, the only pathway, like I was saying, to kind of long-term development or to peace is to have nationally owned systems. And this kind of needs to be integrated at the start, or at least far earlier in crises than we see at the moment. And then thirdly is the need for kind of more effective dialogue or more effective coordination mechanisms in these countries. So in order to facilitate the transition from humanitarian to development, we really need actors to not just come with their own mandate and their own program and funding, but genuinely look at where can we jointly work together, and what's the ultimate aim here in terms of serving the populations that we're working with, as opposed to just perpetuating again, the specific programs of different agencies.
Thank you. Yes, that coordination and collaboration across agencies and all actors is so vital in these sort of humanitarian development settings. I'm wondering, this is sort of a little bit of a different question, but how do you think there's any evidence, or how can these ways of working or just social protection contribute to strengthening peace? So in situations when you have a lot of conflict and distrust and fragility, do we actually think our social protection contributions can actually lead to social cohesion and peace? Do you have anything on that?
Yeah, so I think I'm aware actually that really day to day I work in a country context where you are actually trying to navigate kind of implementation challenges. But I would say personally that my understanding of all of these different issues and questions still stems from this kind of like normative framework, I guess, or like the reason why we're working on social protection to begin with. So at the theoretical level, then social justice would be intrinsically linked to peace building. That's in like the first line of ILO's constitution from 1919, so over 100 years ago. And then the theory is that these international standards that have been agreed by everyone, they're rights-based, they're based on equality, they're sustainable, they're inclusive, that these international standards would lead to social justice and therefore to kind of long-lasting peace. You can kind of see that, you can imagine that to be the case when you think of some of the guiding principles in the standards. So things like consensus-based national dialogue, like Maria was mentioning, but that being really broad-based to ensure that as many different groups of society are brought in as possible, or like inclusive approaches to social protection, or again, solidarity and financing between different groups. So you can see how the theory would lead to something being more peaceful, but I think more work is needed to actually document this. I personally would say it probably is happening, it's just not documented so clearly at the moment. Yeah, and I think again to say that the key is to have in mind from the outset for all of these actors what we're actually working towards, because otherwise you have this development and humanitarian industry, and I mean Palestine is like the home of all of the different development and humanitarian actors who keep existing there forever, and we need to, it's impossible, it's complex to try and build a national system when you even struggle to define who the state are, but that is the only possible way we can ever move towards peace.
Thank you. I realized that was a difficult question, but yes, you talked about inclusion. So let's move to Maria. Maria, you're the lead author of UNICEF's flagship report on gender and social protection that just came out, and that synthesizes the finding of the GRASP research program at INICEF. And you have also led 2 of the country case studies for that research in Ethiopia, one on the integration of gender in social protection design processes and one on the integration of gender in implementation processes. So based on that research that you're doing, can you tell us a little bit, and our listeners, how can social protection programs help sort of traditionally, or what they would think of as excluded groups, particularly in terms of gender equality and social inclusion?
So from the global evidence review, there are, well, 2 overall findings, and they might not come as a surprise to some of the listeners who are working or researching social protection. So first is there are many positive impacts of social protection for recipients, even though, for example, cash transfers might be very, very small, as we said at the beginning, but they are important. And this has been established by several impact studies. And but the impact obviously depends, as we said before, on the type of social protection that is given. So it's not all just cash transfers. And my colleagues at UNICEF Innocenti, they actually undertook a systematic review of reviews of impacts of different social protection programs for men and women. And they have mapped out the different impacts. And in the case of social cash transfers, for example, they find that those programs have a range of different benefits. So improved savings, investments, utilization of healthcare services, and as well as labor market participation. And they also mapped the impacts of other social protection instruments, such as social insurances. They also find that the devil is in the detail. And this is the second overarching finding, because the evidence base also suggests that social protection can also have adverse outcomes. And this is something that has been emphasized by critical scholars and feminist researchers, for example, Tara Cookson in her book on cash transfers in Peru and the implications for women. And now our UNICEF flagship report that synthesizes 11 country case studies highlights 2 important areas that will need much more attention, because this is really the areas where we need to think through how we can better and in a more just way include women. and girls.
Mm.
And the first one is really to ensure that interventions do not increase women's care and time poverty. And the second one is to ensure that women are also enabled to meaningfully participate in decision making. And that includes decision making at the household as well as in the community level, but also within higher level policy processes.
Yeah, good. So you've talked a little bit then how you can think about making programs more gender sensitive. I don't know if you have any other specific examples of how you might design or implement a specific program to cater for vulnerable groups, be they women or other groups.
Yeah, this is actually a question I've thought a lot about. And there are a lot of lessons that are coming out of my own research on Zambia, but also out of the research on Ethiopia. And for example, the case studies of Ethiopia, where international organizations really influence the policy space. Well, they suggest a lot, but they're suggesting three key things, perhaps, that needs to be taken into consideration to ensure that vulnerable groups like women can benefit from social protection in a just way. And the first one is the one that I've mentioned at the beginning and that we have mentioned throughout. It's a crucial one. It's participation. We need to ensure broad-based participation in all stages of the policy processes, from design to implementation. And this is particularly important if initiatives are intended to have transformative implications and results. So when they implicitly or explicitly challenge people's deep-rooted beliefs about deservingness. And then the second one is really at the bottom. So I'm a social worker at heart, and it is about the social workers. We need to empower those social and frontline workers who are supposed to implement those programs. And we found that in many cases, they are overworked, they are underfunded, or there is a rapid turnover of staff, and the remaining social workers are really at their limit. So they're trying to do the best they can with the little they have and the understanding they just have about the programs to implement those. So we need to direct much more resources into the delivery channel, into the actual program implementation, rather than investing on a year-to-year cycle into redesigning and adding a new shiny thing to social protection. And then the last thing is, in order to allow for participation and to enable frontline workers to do their jobs well, we need to find a better and a less abstract language and means of communications. So the current social protection discourse can be very, very abstract and technocratic. So we're talking about means testing, we're talking about exclusion, inclusion, all these abstract terms. This can be sometimes very so abstract and so technocratic that it actually excludes so the vital actors, like the recipients themselves, from the discourse that actually they should be concerned about. And also it impedes on the communication between the social protection experts and policymakers and the gender experts or inclusion experts. It impedes on their communication, and that there can be actually synergies created. And so we need to work and rethink how we talk and write about social protection. And make it easier for normal people to who have not studied social protection to understand why they should be concerned about those debates and why they should actively be engaged and invest their time into talking and thinking through this.
So tell us, what are you working on now? What will you work on next in terms of gender, just briefly?
Well, there are two big tasks ahead for me. One is really practice oriented, and the other is more of academic nature. So the first one is walk the talk. So at Ladysmith, I'm currently working with brilliant feminist researchers and minds, Tara Cookson and Rimal Mokdad, to design a training package for UNICEF Southeast Asia and the Pacific that helps to put some of these key lessons into action. And this involves as we talked before about deliberation, participation, and awareness raising, moving away from buzzwords into passwords, operationalizing what is a social protection system, and enabling those social workers and women's organizations to come to the table and help to design systems, to help to understand how social protection actually can be delivered and what are the issues of social justice that come through. And the second task, well, this is a task that I had put on hold for now the last years because of all the exciting research opportunities that popped up. And it is to return to my PhD on Zambia, on the negotiations of the welfare regime and the transformative potential of cash transfers, and to turn it into a book. Because this research offers a more holistic perspective on the transformative processes and the power relations and the dynamics that can perpetuate poverty and injustice for women. So it connects these two insights, the insight that we have from how to integrate gender into policy processes at the top, the high level, the policy making, as well as the implementation. Because these processes are connected. So policy making and implementation is intrinsically connected. And we need to understand this connection and this bigger picture if we want to improve the prospects of social protection to actually generate transformative and lasting impacts.
I don't know if there's any other final comments, Charis.
Yeah, thanks. I mean, thanks to the colleagues on the panel for such an interesting discussion, because I just want to add a couple of different things based on the points you were making. Firstly, is more like a kind of process learning for how we worked in Palestine on coordination between humanitarian and development actors, but I think it links to kind of wider participation as well. And basically, we've found that using adaptive management and starting from not coming in and trying to impose our idea of what social protection should be, but instead with a group of actors, just going to kind of a blank sheet of paper and seeing where is a very minor area where we can coordinate, like on one list of beneficiaries between two actors or something, very minor. Can we try out doing coordination in this way? And if it works, we learn. If it doesn't, we learn. And we kind of build up legitimacy as we go along so that eventually you reach a Palestinian specific, context specific design of a social protection system. So I think we've really found that completely changed. We were working in an impossible context, and it completely changed the way that actors were communicating and the kind of possibilities of what was possible or not. So that was the first thing. And then my second, other kind of completely off the side final thought is that at the beginning, we defined around the purpose of social protection and it being to protect vulnerable people. But I think also crucially, another aspect in terms of linking to peace building as well is to build the social contract so that these transfers or this system has to be led by some kind of national national authority or a state that is then seen to be linking to these individuals and supporting them and protecting them in order to build these kind of holistic systems of protection. And that again links to the need to be like somehow state-led or nationally owned or locally owned, even if it's not at a national level. So I think it's not the purpose of social protection itself. There are cash transfers which have the same purpose of supporting vulnerable populations, but then this concept of social protection being led by the state has this wider, much bigger kind of development objective kind of integrated into it.
Well, it has been wonderful hosting you all today on our podcast. And I guess our hope is that the discussion you've just heard, we've just had, together with the contributions that you will see in the IDS Bulletin, are going to help challenge our assumptions that tend to lock us into models that are not yet delivering protection for over half the world's population. But hopefully these discussions are also going to prompt us to think in a fresh way about ways to reimagine social provisioning that is transformative for the lives and livelihoods of the poorest and most vulnerable as they face an increasingly uncertain and unpredictable future. So thank you so much, Maria, Charis, and Jeremy, and wish you all well in your endeavours in social protection.
Thanks for listening. Please subscribe and share to help us spread the word. Do you have a feature that you'd like to appear in a future episode? Then get in touch on email at betweenthelines@ids.ac.uk.